Bryan Krumm. I'm a psychiatric nurse practitioner. I'm the Bishop of Medicine for the Zen Zion Coptic Orthodox Church. I am one of the authors of this medical cannabis law. I'm the director of New Mexicans for Compassionate Use. I've been working on this issue for a very long time. To start out, I would like to commend Dr. Hallwell on his courage in coming here today. It takes a lot of courage to stand by your convictions. And I think, although misguided they may be, I think that his heart is in the right place of wanting to protect the citizens of New Mexico. I had actually come out intending fully to file a complaint against Dr. Hallwell's license. However, and speaking with a very good friend of mine who I have a great deal of respect for, a friend who knows Dr. Hallwell and has some respect for Dr. Hallwell, I realized this may not be the best approach, going after somebody individually because they are uneducated is not a valid thing to do. His intent, although it might be good, it's very misguided. I mean, he brings up so many issues that just do not hold true. Cannabis has very important therapeutic value in helping to treat PTSD. I manage somewhere around 1,000 patients in New Mexico's medical cannabis program for treatment of PTSD. Every day, I see the benefits of cannabis and the treatment of this disorder. The reason we have so much difficulty in treating PTSD is because we have three very separate and distinct clusters of symptoms. We have numbing and avoidance symptoms, depression, not wanting to do things, avoiding your loved ones, not doing activities that you have an interest in. We have re-experiencing symptoms, we have flashbacks, we have recurring negative thoughts, we have nightmares that come up, and then we have just the general hyperarousal type symptoms, the being easily startled, paying attention to every noise and movement around you, never being able to relax. It's because we have these three distinct clusters of symptoms, and they all involve different areas of the brain that our current psychiatric medications are so ineffective for addressing this. Cannabis is the only medication we have available that effectively addresses all three of these major symptom clusters, and it does so incredibly safely and consistently. I have never, in my practice, used another medication that has shown as consistent benefits as I see from cannabis. One of the things that we address concern about is the potential for addiction with cannabis. The medications that we use commonly for treating PTSD can be highly addictive. We commonly use benzodiazepines to help with the anxiety. We use antidepressant medications, which, if any of you have tried to withdraw from an antidepressant, that can be brutal.
Right.
We will turn to antipsychotic medications when we can't manage the irritability and the anger. We will turn to adrenergic blockers like prazosin when we have continued hyperarousal symptoms. Eventually we end up with these drug cocktails that we have absolutely no idea what type of impact they're going to have. Long-term effects on organ toxicity can be incredibly deleterious with these medications. And as I said, they are not always effective. We're failing in the field of psychiatry.
Right.
I mean, you look at the rates of remission with the antidepressant medication. You're talking 30 to 40% remission rates if you're lucky. With antipsychotic medications, the same is true. For people who are not responding to medications, we might turn to the old tried and true electroconvulsive therapy still. I mean, we're still practicing psychiatry the way we were in the 1950s. In the early 1950s, we really didn't have much in the way of psychiatric medication or psychiatric treatment. We had people who were giving opioids to help to treat depression. It was the heyday of ice pick lobotomies. We were using immersion therapy. We had people who would go out and do a lobotomy, one ice pick in each hand, just for showmanship. These were horrible treatments. They were highly ineffective. Then in the early 1950s, we stumbled onto something new. There were some chemists who were trying to alter antihistamine medication, and they stumbled onto a phenothiazine that had potent antipsychotic benefits. Suddenly, psychiatry had changed. We finally had a medication that could help with treating psychosis. Not long after that, some scientists trying to alter anti-malarial drugs stumbled onto the first MAOI. Although the first MAOIs weren't used for treating depression, they helped us develop the monoamine hypothesis of depression. Once we had that hypothesis in place, researchers started looking at how can we make ways to actually address these monoaminergic systems. So they started tweaking the phenothiazines and they came up with the tricyclic antidepressants. Once again, we're still practicing antihistamine-based medicine. Later, now that we have these antidepressants, antipsychotics, things are getting a lot better. Later in the 50s, they finally developed benzodiazepines. We have not advanced in psychiatry since that point. We have developed newer medications that have fewer side effects, that are safer, but we don't see an increase in efficacy. We don't see any benefits and additional treatment benefit from these newer medications. All we see are increases in prices. When these medications fail, we still turn back to electroconvulsive therapy. In extreme cases, very rare cases, we still turn to psychosurgery, the new, safer alternative to an ice pick lobotomy. Cannabis offers the first real change in psychiatric medicine that we've seen since the 1950s. And it's not a new change. This is something that's been around for a long time. We've known for a long time that cannabis can be helpful in treating depression. One of the things that Dr. Allrowing brings up as a concern is the risk for psychosis brought on by cannabis. And yes, there are some very rare